Welcome to Biologic Body3D. In this video, we visualize the most feared injury in sports, the ACL tear. The knee is the largest and most complex joint in your body, where the femur meets the tibia. Deep inside, holding these massive bones together, are four crucial ligaments. The star of the show is the Anterior Cruciate Ligament, or ACL, sitting right in the center. Its main job is to act as a seatbelt, stopping your shin bone from sliding too far forward. It also controls rotation, keeping the knee stable every time you twist, turn, or jump. Sitting between the bones are the menisci, cartilage pads that act as shock absorbers. Powerful muscles like the hamstrings and quads work with the ACL to protect the joint. When everything is balanced, the knee can handle incredible forces, until one wrong move. ACL tears rarely happen from contact. They usually happen when you are all alone. It starts with the plant. Your foot hits the ground and sticks, unable to rotate. But your upper body keeps moving, twisting violently with all your momentum. The knee collapses inward. This is called valgus stress, the nightmare position for the ACL. Inside the joint, the ligament is stretched like a rope being pulled by two trucks. First, microscopic fibers begin to fail and fray under the massive tension. The shin bone shears forward, slipping out of its natural alignment with the thigh. Then the limit is reached. Pop! The ACL snaps completely in two. It's a violent rupture. The tension is released instantly, leaving the ends flailing. Without its stabilizer, the knee gives way, causing the athlete to collapse to the ground. The pain is instantaneous and blinding as the nerves around the joint fire panic signals. The ACL is full of blood vessels. When it tears, the joint begins to fill with blood. Within minutes, the knee balloons in size. This rapid swelling is a hallmark of an ACL tear. As the bones shift, they smash into each other, leaving a painful bone bruise inside. Sometimes the MCL and meniscus tear along with it. This is the devastating, unhappy triad. A partial tear is like a frayed rope, but a full rupture means the cable is cut. Women are at risk due to a wider pelvis, which puts more natural angle stress on the knee. Some people have a narrower notch in their bone, acting like a guillotine on the ligament. Doctors use the Lachman test, pulling the shin. If it slides forward, the ACL is gone. An MRI confirms the damage, showing a wavy or missing line where the tight ligament should be. Can you live without an ACL? Only if you have perfectly trained muscles to compensate. For athletes, surgery is usually required to reconstruct the ligament and restore stability. Surgeons often harvest a piece of your own hamstring tendon to create a new ACL graft. Or they use the patellar tendon, taking a piece of bone with it for stronger healing. They drill tunnels precisely through the femur and tibia bones to place the new ligament. The new graft is threaded through these tunnels, mimicking the exact angle of the original. It is locked in place with screws or buttons, holding it tight while the bone heals. The body then does something amazing. It grows new blood vessels into the dead tissue. But be careful. At 6 to 8 weeks, the graft actually gets weaker before it gets stronger. Returning to sports too soon during this weak phase is the #1 cause of re-injury. If rehab is ignored, scar tissue can form a cyclops lesion, blocking the knee from straightening. Rehab starts immediately. Gentle motion is needed to keep the joint from freezing up. You must wake up the quad muscle, which shuts down completely after the trauma. Balance training is critical to reteach the nerves where the knee is in space. You must learn to jump and land correctly, knees over toes, never caving inward. Landing stiff-legged is dangerous. You must use your muscles as springs to absorb shock. The mental battle is the hardest part. Learning to trust the knee again takes time. A brace can offer support, but it cannot replace the function of a strong muscle. Even with surgery, the risk of arthritis increases later in life due to the initial impact. Strong hamstrings are the ACL's best friend, pulling the tibia back to safety. Strong glutes keep the hips stable, preventing that dangerous inward knee collapse. Neuromuscular training teaches your body to react faster than the injury can happen. Artificial turf has more grip than grass, locking the foot and increasing tear risk. Wearing the right cleats matters. Too much traction can be a recipe for disaster. Fatigue kills form. Most ACL tears happen at the end of the game when muscles are tired. Contact injuries happen too, when a blow from the outside forces the knee to buckle. But 70% of tears are non-contact. It's just you, the ground, and bad mechanics. In kids, surgery is tricky because drilling through growth plates can stop bone growth. The pop sound is so loud it can often be heard by teammates standing nearby. Immediate ice helps manage the swelling, but it won't fix the instability. Prehab means getting strong before surgery. A stronger knee entering surgery heals faster. You aren't ready until your injured leg hops just as far and stable as your good leg. Don't confuse a compression sleeve with a brace. One is for swelling, the other for stability. Hyperextension, forcing the knee backward, can also snap the ACL, though it's less common. Genetics play a role. Some people naturally have looser ligaments or weaker collagen. It all connects to the core. A weak trunk allows the body to sway, stressing the knees. Recovery is a marathon, not a sprint. It takes 9 to 12 months to be truly game ready. With proper rehab, the new ligament can eventually become even stronger than the original. Thousands of athletes return to peak performance after this injury. You can too. Train smart, land soft, and keep your legs strong to protect your ACL. For more 3D anatomy breakdowns, like this video and subscribe to Biologic Body 3D.